We are live, and I have every reason to believe. I know it's a bit late, but that's because my computer's really slow, and I think I'm live on TikTok as well. So I think I am. So 29th of October, the first TikTok live Q&A. So make a date in your diary because people will be talking about that in the annals of history. But I'm also on the Gram and the Tube and the book. So there's no excuse now for world domination. The reach is just growing. So yeah, this is a Q&A. It's plastic surgery related. I'm a plastic surgeon, and if you've got any questions, I will do my best to answer them. I've got some questions that people have already asked, so don't panic if you haven't got anything to add to tonight's content. I'm not sure if you can say things on TikTok. Can you say things on Instagram? Why don't I break the ice, get things started, and with this question here: will a cyst come back after having it surgically removed? It might. Yes, it might. It is possible. Basically, there's different ways of removing cysts, and they range from kind of bursting it, draining it, lancing it type scenarios through to kind of formal surgical excision. And you can never 100% guarantee preoperatively that you will be able to remove all of the cyst wall, but that's what it comes down to, removing all of the cyst wall. The aim is to remove the whole cyst, ideally intact, but it often breaks. But even if it breaks, just make sure you get all of that cyst wall, because if we leave any of the cyst wall behind, it can come back again. So the most effective way of doing it is to do a surgical excision where you make an elliptical excision over the cyst. You make an incision about the diameter of the cyst, and you can kind of see the wall, and you try and get the whole lot out. Now, some people will try and minimize. Oh, swipe to see real-time performance. Yeah. Okay, real-time performance. Nothing's happening. Okay, awesome. Good to know. Some people will make minimal incisions and kind of empty the contents of the cyst, and then try and get the cyst wall out through that minimal incision, through a very small incision. And that's good because it's a very small incision, but the issue is that it's much more difficult to make sure you remove the whole cyst wall, because you've emptied the sac and you're trying to get the whole sac out with it empty. So it's difficult. So there's more chance of it coming back again. So personally, I don't do that. I do a formal excision where I excise over the whole cyst and I aim to get it all out complete, because I feel that has got a much lower rate of recurrence, but it's not zero. And I have had sometimes to go back and remove a cyst that's come back again. Usually, I would maybe always, but certainly usually I would say when they are recurrent cysts. So when they've had it done previously, or if it has previously been infected and there's scar tissue around the area. So that makes the cyst wall quite scarred and a bit more difficult to delineate. So those are the situations where you've got a higher risk of recurrence if you had previous infection or previous surgery. So if it's a recurrent cyst, because there's more scar tissue in the area, so there's more risk of it coming back again. If it's a first-time cyst, never been infected, there's less risk of it coming back because we can see the wall and we can make sure that we get it out complete. But as I say, we never know preoperatively that we'll be able to do that. So we can't give you a 100% guarantee. But what we can say is the most effective way of removing a cyst is with it being surgically removed in that way. So it's got the least risk of recurrence. And so that's what we would do and we would recommend. And we have got a very low risk of recurrence. And if it does come back, as I say, we can always do it again. But of course, that's not ideal. What does histology mean? So histology means that we send the moles cysts, lipomas, we send them away to be analyzed under a microscope. So that's what histology means. Histology is the art or the science, probably science, isn't it? The science of looking at things under a microscope, looking at the tissue under a microscope on a microscopic level to ensure there's no sign of any cancer. Basically, that's kind of bottom line of what we're looking for. Sometimes we get kind of unusual things and interesting things, but at the end of the day, what you really want to know is it cancerous or not? And even when clinically we think it's not cancer, often we will send lesions off for histology just so we have that in black and white. And that is actually one of the things we changed a few years ago, where we used to kind of offer histology as kind of like an option. Because there's a cost associated with histology, so we had two prices, but that wasn't very good, because sometimes people would say, oh, I don't want histology because I'm sure it's fine, and we'd be like, well, we think it's fine too, but we would be more comfortable with doing histology, which puts you in an awkward situation, because you should really often, certainly with a big pigmented mole, with a sort of brown mole, it is good practice to send it for histology. So it often is a bit kind of anyway, we've just taken the decision making away from you, and we make the decision as surgeons. The surgeon will make the decision as whether it goes for histology or not, and there's no extra charge with it. It's kind of bundled up in the price. The price is the price, whether or not you have your lesion requires histology, and that just takes that element of decision making out, because kind of like it's a medical like decision, really. We shouldn't really be putting that on you as a patient as to whether you have histology or not. That's really up to us to decide whether we think it's troublesome. And pretty much all brown, like pigmented lesions, we send for histology. We usually send cysts and lipomas away as well. But that's what it is. It's looking at under a microscope, so then you get reports saying, yeah, this is a cyst or a lipoma or a mole, or talk about the different types of moles. But as I say, essentially, it's whether it's cancer or not. With moles, you do have a kind of intermediate level, which is called dysplastic nevus, which is not a cancerous nevus, but it's kind of on the way. So it's a sort of changing mole. So it just raises a little bit of your suspicion on further moles. That mole itself usually doesn't need any more treatment, but if you have something like a dysplastic nevus, it just means you've got to keep an eye out, because it was kind of changing and potentially could have turned cancerous. So yeah, that's histology for you. What happened? Oh, there you go. Look at that. This is almost like this is planned. What happens if my mole is cancerous? So yeah, what we would normally do, had this conversation earlier on today actually, is even if I didn't think it was cancerous earlier on today, but there was sort of like a question mark about it. So even if we kind of thought it was cancerous, the good practice is usually just to take it out completely, so to remove it completely, and then get it analyzed histologically. So get the tissue looked at under a microscope to look at what sort of cancer it is and how bad it is, if you like. That often means kind of depth of invasion. So they'll look at the cancer and see how deeply it's invaded, and based on that, then they'll look at how clear a margin we've got. So with cancers, we want to have a clear margin. So where the cancer sort of sat in the middle of the specimen, we want to have a sort of rim of normal skin, like the cancer's in the middle of the field, and we kind of want to see grass, all the way around outside. We don't want the cancer going up to the hedge, up to the fence, up to the boundary, because if histologically they see the cancer going up to the boundary, there could potentially be the other side. So then you would need a further excision. So we need to see a clear margin. With some types of cancer, basically malignant melanoma I'm talking about here, so there are different types of skin cancer: basal cell carcinoma, squamous cell carcinoma, malignant melanoma are the sort of three common ones. So with malignant melanoma, even if it is completely excised, then we would want a further excision, and that further excision the extent of it would depend on the depth of the invasion. So that's only something you can tell once it's been sent for histology. So even if we thought it was a malignant melanoma, we wouldn't take it out with a big margin, because we don't know how much margin to take until they've got it analyzed. With a squamous cell carcinoma, basal cell carcinoma, by and large, if they're completely excised with a clear margin, by and large, that is sufficient. So they need to have a clear margin, and that's enough. But if the margin is incomplete, if the margin is not clear, or if it's a malignant melanoma, then you would need another operation to take a wider margin around the scar. So you basically cut out your old scar and take a wider margin around that. And with a malignant melanoma, not only do we need to go wider, but we also need to go deeper. Well, with all of them really, because the BCC or the SCC could be incomplete on the deep margin. It depends on what margin it's incomplete on, so we might have to go deep on those. But certainly with a melanoma, you do often have to go quite wide and quite deep, so you have to take quite a substantial piece away with the melanoma. So the first step is to get the mole sent off, so we can analyze it under a microscope, so we can see exactly what it is. If it does turn out to be cancerous, then you may need a further operation to take a wider margin around the scar. Is cauterisation of a cherry angioma the same as mole removal? No. So a cherry angioma, so an angioma is a little collection of blood vessels, so it's just a little red cherry, I guess, because it's red, little red thing. And so sometimes you can just so cauterisation is the thing that we use when we're actually doing our minor procedures. We are using a there's different types. We tend to use forceps, which are like tweezers, and the current goes between the two prongs of the tweezers. There's another type which is like a point diathermy. So sometimes, rather than actually removing the lesion, the cherry angioma, you can just usually with a point diathermy kind of cauterize it. So it's not the same, but it would depend on the size of the cherry. So that's for sort of very small ones. So if it's got any sort of size to it, then you could excise it like a mole removal, but then that will become a excision rather than cauterization. So cauterization is just literally kind of burning. Sounds bad. Well, cauterizing, I guess, sounds better, doesn't it? Cauterizing that blood vessel rather than excising the lesion. Either way, it's removing the lesion. I wouldn't get. This is the problem with the internet. People get so deep into stuff. I wouldn't get too deep into it, to be honest with you. I would just, just go with whatever the doctor said, as long as it sounds reasonable. So yeah, cauterization is a reasonable treatment for a cherry angioma. What is a see and treat clinic? Well, I'm glad you asked me that, because that's our big thing at the moment. We are working on the see and treat kind of service. So I've recently stopped doing the general anesthetic cases, the bigger cases. So I'm personally just doing the local anesthetic cases where you kind of awake. And to that end, I'm trying to build that side of the practice with the local anesthetic cases. And because I've got my own theatre at my clinic, rather than having to work from the hospital, which you've got, when you work at the hospital, there is a minor ops theatre, but it's you usually have to book it for a kind of list, for a minor ops list, and say, look, on this day I want the minor ops theatre. But basically my theatre is in the clinic kind of all the time. So what we're doing is this see and treat service, which means that we will it requires you to send a photo. So if you send a photo, because the thing about moles, cysts, lumps, bumps, you often know you want it removed. Often people kind of know they want it removed. So the consultation, you might get something out of the consultation. You might, get an idea of something, but often we're not actually telling you anything you don't know in the consultation, because it's like, oh yeah, you got a mole, you're going to remove it. I mean, might show you a photo of a scar or something like that, but you often know you want it removed. So rather than making you come for the consultation, which is a standard way of doing it, you come for a consultation, you say, oh yeah, you got a mole, Do you want to? Yeah, we'll book it. We'll put you into the minor ops theatre next week, next month, or whatever. What we're doing is we're saying, look, send us a photo. We can tell you how much it's going to cost, because that's the other thing about cost. Posted on the gram today. I don't know if any of Gram viewers saw my post today. Cost of post. I think it came out as a little video. I don't think I wanted it as a video. I think I meant to do it as a picture, but you know, can't have everything. So yeah, people often ask the cost, and we're often a bit cagey about the cost, which I always feel bad about when someone says, "What's the cost?" I've done a YouTube video about cost of mole removal, and all the comments says, "No, you never said the cost, never said." And it's hard because we always say from, because a mole could be a little tiny little mole, or it could be a big mole, you know, and it could be in it could be an easy area like on your abdomen, or it could be on your eyelid, you know. So it depends on where it is, depends on the size of it. So what we've started doing is we started saying, look, don't have to come for a consultation, don't have to pay or anything like that. Send us a photo and we will give you a view on that, and we will send you a price. So well, first we'll tell you whether we can do it, and then to give you a price so you know what it's going to cost. And then we can put you in for these see and treat appointments. So the see and treat appointment means you come, you booked in, you pay £100 deposit, but you get that back if you don't have the surgery for any reason. We just had someone this morning who didn't have it because she didn't know she had to come back next week for the stitches, so couldn't come back next week. So you know, that's fine. So you know, if you can't do it for whatever reason, then you can have your £100 back. But what the £100 does is it secures you for usually like a 2-hour slot. So you come, we'll have a consultation, and then if you want to go ahead, we're there ready to go ahead. So it saves you coming backwards and forwards from the clinic. So it's a one appointment. As I say, you might need to come back a week later to have stitches removed, particularly if it's something on your face. But then after that, we can do things virtually if you want. You're always welcome back at the clinic if you're worried about your scar or you want me to have a look at it. But if you're not, we can always just do things virtually by phone calls, video calls, and stuff like that. So just trying to streamline the process for patients to make it a bit easier for them to kind of access the treatment, because you do hear people who are struggling to get, you know, GP appointments and struggling, you know, on waiting lists and all that sort of stuff. So it sort of cuts all that out. There's no waiting list. You just send us a photo, you book in. And the other thing I'm trying to do is I'm trying to ensure, I don't know how long this will last, you know, but hopefully as we get busy, we can scale things up, trying to ensure we can offer you an appointment within 7 days. So that's something that I'm trying to, you know, a couple of things I'm trying to do with the clinic to sort of build this see and treat service. Say, look, we will offer you an appointment within 7 days. Obviously, if you want it in November or December or January, you can have the appointment in those times as well. But particularly if you're worried about it, because I know there are people out there with things that they're worried about, that may be on NHS waiting lists, maybe, you know, waiting to get seen or waiting to have a procedure. So if you are worried about it, we will aim to give you an appointment within 7 days. And that means an appointment for your definitive treatment. So a see and treat appointment. So you have it done, have it removed within 7 days of you getting in touch. In fact, we just got a Google review from someone who said, oh, I phoned on the day and got it removed on the day. So that's not always possible, but, you know, that's the sort of thing we're working towards. A bit like, you know, Amazon doing the drones and dropping your Amazon parcel the same day as your if you order it. You know, that's the world we're going to, and that's what we're you've seen it here. TikTok, you're on the start of something big here. So that's what I'm trying to do. I'm trying to do trying to build a service where we can be quite what's the word, responsive, you know, quite responsive. So particularly if you're worried about something, sometimes you see photos and don't like, look at that, let's get them in. So that, you know, we do, it's not uncommon to get people in the same day, but certainly, as I say, even if it's not a worrying thing, it's just a nuisance, aiming to give you an appointment within 7 days. And as I say, that's an appointment for a definitive treatment to have the lesion removed. So that's what a see and treat clinic is, and that is what I am trying to do and promote. Got a new website, seeandtreat.co.uk. Don't go there yet because I'm still building it. Yeah, that's what that is. Thanks for asking. What if I am not happy with my scar after treatment? Right. Well, this is one of the reasons why we have a big long chat with people, because, you know, if you've got a mole or lesion. Now, if you're worried about skin cancer, then obviously you've got to remove it, and it's easy decision to be made. The difficult decisions is if you're not worried about skin cancer, if the thing doesn't look like it's a skin cancer, then that's a difficult decision because it's going to leave you with a scar. And so this is something that it kind of depends on how much the lesion, the mole, the lipoma, the cyst, whatever it is, how much it bothers you as to whether you feel comfortable trading it in with the scar. And the issue is we can never be 100% tell you what the scar is going to look like. We can show you other people with scars to give you an idea of what kind of scars look like, but we never know exactly what you're going to look like. So it is always a difficult one. And so if you're not sure, I always say to people, have a think about it, just don't, no stress. Obviously, if you're not worried about it being cancerous or anything like that, because if you have a scar, if you have the scar and then you say, I'm not happy with my scar, it's difficult. Because sometimes people contact us for scar revision, and yes, we do scar revision. We're all plastic surgeons, and we can revise scars, but there's got to be kind of like a specific problem with the scar. We can't kind of remove the scars, so it kind of depends on why you're not happy with your scar. So if there's a problem with the wound healing, if it gets infected, if it opens up, the scar's a bit stretched, a bit wider than we'd like, fine, no problem at all. We can revise it, let it settle 3-6 months, let it all settle, let it all heal, and then we can cut it out and stitch it up again and revise that scar. So yeah, if the scar's stretched or a bit indented maybe, then there are things we can do. If the scar's raised and active, yes, there are things we can do, starting from non-surgical things, moisturized massage, silicone, steroid injections. There are things we can do for raised scars. If the scar's a bit red, well, normally in my experience, time is the best thing for red scars to let them settle. If they're really taking a long time to settle, laser can help with red scars. So there are certain things we can do for certain types of scar. The problem is if it's not red, if it's not stretched, if it's not in a bad line, that's the other thing. If it's not quite sitting right in a good line, if we try to hide it in sort of natural crease or natural line and it's not quite sitting there properly, we can adjust it and change how it sits. So those are things we can do about scars. But if it's just the fact that there's a scar, if it's kind of gone skin colored, you've left it 6 to 12 months, it's gone skin colored, the line is sitting in a good line, it's not raised, it's not dented, there might not be much we can do. So it kind of depends what the problem is. So we can't kind of remove the scar, but we can change the scar if there's a specific problem with it. But it is a thing, scar revision is a thing, and we're, as I say, we're all trained plastic surgeons, so we all can do scar revision, but it's about being aware of what's possible, because we can't just remove it if you don't like the scar. We can't sort of go back and give you back the mole. Obviously, it's once you've done it, it's done. So yeah, so that's that. So that's it. I'm out of questions. So if you've got any questions, obviously I'm a busy man. I've got things to do. Got a sofa next door which needs to be sat on. So that is what I am actually going to do in a minute. If there's no further questions, I'll say no further questions. All the questions were from me. But anyway, yeah, no, that's okay. Obviously, I'm busy. Well, nice to see you, TikTok. Good to have you on board today, and long may our relationship continue. Hopefully, I will be able to stay on the platform and not get banned like I have been in the past with Instagram and Facebook. But I've learnt my lesson, and I don't post nipples anymore. So hopefully, I won't be in breach of any Facebook, Instagram, TikTok laws. I don't know, but anyway, so we're keeping us well away from those sorts of dubious images. And so yeah, same time next week, I guess. What's next week? So it's half term this week, isn't it? And I did it, so I can't see any reason why I won't do it next week. 7 o'clock next week. If you have questions, message me. Yeah, call me. Whatever, because we need to think of something to talk about next week. So yeah.